Hello, my name is Michelle Garcia, nursing student, and today I'll be showing you how to insert, remove, and empty a Foley bag. Okay, so I have introduced myself, conducted hand hygiene, confirmed that I have the right patient, verified my orders, and checked for allergies. I have assessed the penis for redness, swelling, or breaks in the skin. We have already conducted the cleaning of the penis, and now we are ready to insert the catheter. I will perform hand hygiene and start by communicating with the patient as we go through the procedures and make sure that I keep their privacy as much as I can. Right now we have his blankets all the way down and we have a towel covering his private area to keep privacy. I have also raised the side of the bed. I have also raised the bed up waist high to help from me having to bend over. So now I would grab my Foley catheter tray. I would open the package. As you can see, it had already opened this one. I had messed up my first video, but we're gonna pretend this is fully covered and sealed. I will get it out of the package, place it here, and I will start by pulling away towards me. Sorry, pulling away from me first. I did it right, I just said it wrong. And then this way, and these already popped open. Okay, so now that I have my sterile field here, 1 inch is considered unsterile. So I will grab my gloves. And start by putting my gloves on. I want to make sure I don't touch the actual glove, just the inside part of the cuff. Like I said, just the inside part. Now that I have my gloves on, this pinky did not work. Okay. So now that I have my gloves ready, I'm sterile. This is gonna go in the trash. And I will start by putting this small drape in between the patient's legs, just so any spillage, we don't get his bed wet. All right, Mr. Brown, we're gonna start by putting this pad beneath your bottom. So then I would, this is pretty hard, sorry, with the can, but doing my best. All right, and then I would conduct by putting this drape on him just to help with his privacy. I saw a lot of videos that didn't use this, but why not? It helps with ensuring their privacy. Okay. All right, Mr. Brown. Now I will get my stuff organized here, and while he sits there, I get my stuff ready. So then, my trays. I would start by opening my alcohol wipes, getting those out, setting it on my tray, discarding of this. Next, I would grab my lube, squirt some on my tray, put that on the side, and then I will take the plastic off my Foley catheter, but I want to be very careful in making sure I have a full sorry, I lost my words. But I'm holding it. I don't want to let go of it, because if it flings everywhere, it just becomes unsterile. I would step back and drop that into my trash can, come back, making sure this stays in its sterile area. And then I would insert my 10 mils of saline, take the cap off, drop in the trash, and I will look for right here, insert it, okay, so now once I have my stuff ready, set this tray in here, and I would move this to his bed in between his legs in this area that is considered sterile still. Okay, Mr. Brown, we're going to start by cleansing your private area, and I will be using my my non-dominant hand to grab his penis, and I would pull back a little if they're not circumcised. Okay, so I'm holding it, pulling back, and we will use our cotton swab. We're going to go in a circular motion around the urethra. Take it, discard, come back. The other way around, circular motion, discard. Circular motion, discard. Alright, I have no use for this tray anymore. We'll set it back on my side table. Alright, Mr. Brown, now that he's ready, I will start by getting this. Oh, I forgot I still have my lube here. So, since my side table in his bed, just the way I have it set up, it is like extremely close, but technically you can't get out of the sterile field, but right now I am in the sterile field, so I would bring this over here and dab it in here, making sure I have a good hold of this grip. Alright, Mr. Brown, we're going to start by inserting this into your urethra. If I can please have you take a deep breath for me. Once again, so I just now realized what I did. I removed my hand from the penis. You should not do that. So I would still have my hand here, okay, because this is your this is your non-dominant hand. You do not want to sit here and contaminate all these things that you've already have sterile. So this hand is to stay here. I just now realized I had it everywhere. So so I want to go back a step, okay? Okay, so I'm sitting here. All right, Mr. Brown, we're going to start by inserting this into the urethra. Once again, my hand is still on here. Grab this, put it in my lube. I have a good hold of it, okay? Hand is to stay here. And all right, Mr. Brown, can I have you take a deep breath? All right, 1, 2, 3, deep breath. Okay, and so now I'm inserting this into the urethra. This is going to go 7 to 9 inches in. I can see some urine coming out. That means we're in the bladder. Okay, I can't go any further. Mr. Brown, how are you doing? Everything okay? Yes? Alright, and then I will start by inserting the saline into the bulb. Mr. Brown, everything still okay? Yes. Okay. So then discard. And then once I'm done, I will check, see if everything's okay. Mr. Brown, you're going to feel a little pull. Alright, everything's good. Next, I would attach this to the side of my bed. Make sure it's the bed and not the rails. Just so you won't have any upflow of urine that could cause catheter infection. And then I would get all my stuff, discard of it properly, make sure my patient gets covered back up, and I would lower his bed down to the lowest position, give him his call light if he needs anything, and that concludes the procedures for inserting a Foley catheter.